She placed her hand on her stomach and smiled. 2 months pregnant, 2 heartbeats, 1 tiny life depending on her. She looked at her anti-seizure tablet. A thought crossed her mind. Are these medicines harming my baby? She hesitated. I'll skip today, just once. The pill stayed on the table. But inside her brain, the protection slowly faded. The medicine that had been calming the electrical storms began to wear off. And pregnancy itself was already making her body more vulnerable. Hormonal changes, sleep disturbances, stress. Her seizure threshold was lower than ever. That evening, she felt it, a strange smell that wasn't there, a rising fear. Her vision narrowed, and then, she collapsed. Her body convulsed, her oxygen dropped, her baby's oxygen dropped. For 2 minutes, both heartbeats were fighting. She woke up in the hospital, confused, terrified. One question, is my baby okay? A truly terrifying situation. So let's talk about effects of pregnancy on epilepsy. About 50 to 70% no change in seizure frequency. 20 to 30% increased seizures. 10 to 20% decreased seizures. Seizures may worsen due to sleep deprivation, missed medication, vomiting, increased drug clearance in pregnancy. Next, let's move on to what are the various effects of epilepsy on pregnancy. A. Maternal risks. Trauma from seizures. Status epilepticus, which is rare but serious. Increased risk of preeclampsia. B. Fetal risks. Fetal hypoxia during maternal seizures. Preterm labor. Low birth weight. A word of caution: you should know generalized tonic-clonic seizures are more dangerous than focal seizures. Let's talk about anti-seizure drugs and teratogenicity. Some ASMs increase risk of congenital malformations, 2 to 3 times general population risk. High risk: valproate, phenobarbital. Moderate risk: phenytoin, carbamazepine. Safer options: lamotrigine, levetiracetam. Monotherapy preferred over polytherapy. Use lowest effective dose. The most important thing to do in case of a patient of epilepsy who is pregnant is preconception counseling. Plan pregnancy. Switch to safer ASM before conception if possible. Folic acid 5 mg per day. Start 3 months before conception. Achieve good seizure control. Preferably seizure-free is greater than or equal to 6 months. She thought skipping 1 dose would protect her baby. But the medicine wasn't the enemy. Uncontrolled seizures were. So now what are the steps of antenatal management? Continue medication. Do not stop suddenly. Monitor drug levels, especially lamotrigine. Detailed anomaly scan at 18 to 20 weeks. Vitamin K supplementation in last month if on enzyme-inducing drugs. If you're pregnant and living with epilepsy, your treatment isn't just about you anymore. Protect both heartbeats. Never stop your medication without your doctor. You have the responsibility of 2 lives on your shoulders. Remember that. Labor and delivery: most women deliver vaginally. Continue ASM during labor. Avoid sleep deprivation. IV benzodiazepines if seizure occurs. Yes, some anti-epileptic drugs carry risks. But stopping them suddenly carries even greater risks. That's why treatment during pregnancy is carefully planned. Lowest effective dose, safer drug choices, close monitoring. Never stop medication without medical supervision. This supervision is even more important and serious during labor and delivery so that there are no complications. Postpartum. Seizure risk increases, sleep loss. Adjust drug dose back. Levels normalize after delivery. Breastfeeding. Usually safe. Lamotrigine and levetiracetam are considered compatible with breastfeeding.